Today, what we're going to try to do is walk you through some of the key terminology around the diagnosis of cancer. So, kind of starting from the beginning, what are the words you might hear? When do they come up? How do they apply to you? There is really no way that we can cover every single word in every single scenario, but our goal here is to try to put these words into context so that when you hear these things, you at least can kind of refer back and understand that context. And then we will also have another resource that you can access, which will be some hopefully relatively easy to understand definitions for these types of words so that you can read those definitions online. And then you can come back to this video and try to put it in context again. And obviously, terms, just like any language, really do require practice. So it is important to hear them used in their right context. It's important to read the definition. It's important to come back to that context. And at some point, you also have to use them yourself. So I would encourage you to, with a loved one or some sort of advisor, try to hear this video, try to go back to those definitions, and then use those words with somebody and see if you both understand them the same way. And then use them with your doctor and see if you got it the right definitions, right? If you don't do that, what I think will often happen is that you'll find that people are saying words to you and you don't know what they mean, but you feel like it's too late to ask the question again because you've heard it 4 times by now. I would also just tell you, you should never feel that way. It is not your job as a patient to know all of these words. It is actually our job as doctors to help you understand these words. And we sometimes in our rush don't do that. But it is never wrong for you as a patient to go, whoa, I don't know that word. So you have to help me out. And yes, this resource can help you, but your doctor can also help you with that. So today, Dr. John Marshall and I are going to walk through this scenario of what happens sort of at the beginning of a diagnosis of cancer. How can that happen? How can you be diagnosed? And then what are the steps as you get deeper into that diagnosis to understand things like prognosis and what is the treatment going to be? And I realize I've already used a word that some people may not know, prognosis. So we'll get there. So let's get started. I'm going to hand it over to Dr. Marshall to just talk through some scenarios that might lead to an initial what might lead to a diagnosis. So what are some of these first things? Dr. Marshall, let's talk through some of the ways you see patients that are just finding out that they might have cancer.
The first step is that you're diagnosed with a cancer. And how does that happen? So a lot of times it's people who are undergoing screening. So your mammogram, your colonoscopy, your PSA test, your skin test at the dermatologist, that normal stuff that we are asked to do as part of aging humans to make sure, do we have them or not? And the reason to do screening, of course, is to try and find something before you have any symptoms, before you feel it, and catch it early, because for most of these cancers, catching things early has a much better shot at fixing it in the long run. So a lot of times we catch it with screening. Now, unfortunately, a lot of times we don't catch it. People are having symptoms. They might have a pain somewhere or change in their bowels or maybe a cough or something else is going on where they then have a test. And during the process of that test, based on something that feels wrong in them, they are identified as having a cancer. And then the third category here is that sometimes we're looking at something else. I had a recent patient who was being worked up for a heart problem. And in the process of having scans for the heart, the radiologist looked a little below the heart and found a problem in the pancreas. So we, what I like to call, tripped over it. We weren't looking for anything in particular. It wasn't symptomatic. It wasn't part of a formal screening, but it turned up in a test that someone was having for something else. So those kinds of tests are things like X-rays. X-rays are plain X-rays. There can be CAT scans. There can be fancy magnetic scans called MRIs, PET scans. Those are all fancy scans that often are done as part of a diagnostic workup. If you're a GI doctor like I am, a lot of my patients have colonoscopies or endoscopies where they put scopes in to the GI tract and look around and can find things. And more recently, there's been the development of a lot of fancy blood tests that can detect signs of cancer. We've known about for many years the test called PSA, that's for prostate cancer. That's a blood test, a little controversial blood test that men get as they get older in the hopes of early detection of prostate cancer. But that's evolving to even fancier blood tests that I would predict one day are going to be part of our normal primary care workup, where you go into your physician and they do a screening blood test for cancer. So those are the main ways that we get our first hint that something's going on, either an x-ray, a scan, a scope, or a blood test.